tired of watching as year after year, candidates offer up detailed health care plans with great fanfare and promise, only to see them crushed under the weight of Washington politics and drug and insurance lobbying once the campaign is over. That is not who we are. That is not who we have to be. Enough is enough. It is time for us to change.
Senator Obama, 45 million uninsured Americans. Senator Edwards had said your health plan doesn't really provide universal coverage, does it?
Absolutely it does. John and I have a disagreement. John thinks that the only way we get universal coverage is to mandate coverage. I think that the problem is not that people are trying to avoid getting health care coverage. It's folks like that who are desperately in desire of it, but they can't afford it. And I know...
Senator Edwards, does Senator Obama provide universal coverage?
No, because the only way to provide universal coverage is to mandate that everyone be covered. But
Senator Clinton has a different approach. She believes that we have to force people who don't have health insurance to buy it. Otherwise, there will be a lot of people who don't get it. I don't see those folks. And I think that it is important for us to recognize that if, in fact, you're going to mandate the purchase of insurance and it's not affordable, then there's going to have to be some enforcement mechanism that the government uses. And they may charge people who already don't have health care fines or have to take it out of their paychecks. And that, I don't think, is helping those without health insurance. That is a genuine difference.
Number one, understand that when Senator Clinton says a mandate, it's not a mandate on government to provide health insurance. It's a mandate on individuals to purchase it. And Senator Clinton is right. We have to find out what works. Now, Massachusetts has a mandate right now. They have exempted 20% of the uninsured because they've concluded that that 20% can't afford it. In some cases, there are people who are paying fines and still can't afford it, so now they're worse off than they were. They don't have health insurance and they're paying a fine. And in order for you to force people to get health insurance, you've got to have a very harsh, stiff penalty. And Senator Clinton has said that we will go after their wages. Now, this is a substantive difference.
I know that there have been some folks, some other candidates, who said that it's not possible to provide universal health care coverage unless there's a mandate. Their essential argument is the only way to get everybody covered is if the government forces you to buy health insurance. If you don't buy it, then you'll be penalized in some way. And what I have said repeatedly is the reason people don't have health insurance isn't because they don't want it, it's because they can't afford it.
You are the only Democrat with a serious health plan that doesn't have a mandate in it, and you're kind of proud of that, and I've heard you talk about it.
Yeah.
My question is, how do you're going to have a mandate on the insurers, if I understand correctly, right? They're going to have to sell me insurance.
Yes.
Okay. Now, can I just wait till I get good and sick and then go buy it, or if there's no mandate, what is going to stop me and millions of other people from just gaming the system?
Well, I don't think people are strategic in that way, first of all, in the sense that most people want health care. The reason they don't have it is they can't afford it. I haven't ruled out a mandate somewhere in the future. What I don't want to do is set up a set of false expectations where we say we've achieved universal coverage because we've set up a mandate, but people can't buy the coverage. So there's stories percolating out of Massachusetts already where they'd already exempted a certain number of people. Now it turns out that you've got another 20% of the uninsured who simply can't afford it. They're fining them $200, I think, right now. Mm-hmm. But the premium is $2,000, so, you know.
Well, this is going to work.
Yep.
And if I can delay my pre-existing condition until I'm sick, and then walk in and say, I need, I've got AIDS, or I need a bypass operation, please give me insurance, they won't buy that, will they?
Well, look, I don't believe that any of the health care plans that are out there right now are what the actual health care plan is exactly going to look like when it's passed. Mm-hmm. It may be that if we set up the system in the first term and we still have a significant number of people who don't have health insurance, that I'm open to saying, for example, that there's a trigger. a certain number of people continue not to have health insurance, that triggers automatically within the law the institution of some sort of mandate. The simple point that I don't want to create is a situation where you've got, we say there's a mandate, people have to purchase it, but frankly, they don't have the money to purchase it. And then we've created a bunch of outlaws out of people who would love to have health care coverage but don't have it.
If a mandate was the solution, we could try that to solve homelessness by mandating everybody buy a house. The reason they don't have a house is they don't have the money.
The federal judge in Florida using President Obama's own words to strike down the health care law. Back in 2008, when Obama was running against Hillary Clinton, he attacked her proposal for an individual coverage mandate.
She'd have the government force every individual to buy insurance, and I don't have such a mandate because I don't think the problem is that people don't want health insurance, it's that they can't afford it. Well, if things were that easy, I could mandate everybody buy a house, and and that would solve the problem of homelessness. It does.